Room to order. Good morning, ladies and gentlemen, and welcome to our second seminar in our Seniors Seminar series. Yes, you need to be very sober when you say that. This morning our presenter is Kylie Holmes, who's the new business manager for seniors communities with Anglican. And she has extra bags for those people who missed out. If there wasn't a bag on your seat, Kylie has some extra ones for you. And she has come all the way from Penrith this morning to be with us and has lots and lots to tell you. So I think we better get started. Thank you, Kylie.
Thank you. Yes, I live out at Mulgoa, so I don't know if anyone knows out between Wallacia and Penrith. So I'm a little bit rural as well. So, but a little nice drive. It was a nice drive today. So, thank you for having me, Chris. It's sort of been a few months, or probably 6 months or more in the making. As introduced, my name's Kylie Holmes, and I work with Anglican. Have for the last 9 years. I've been in home care for the last 15. I'm very passionate about it. I could rave on about it all day, but I've got a short time to do that, and I don't want to lose your attention. There is lots of slides amongst this presentation. A lot of them are there's a lot of information, so we've got a copy here for you, so if you want copies of them. The little bags that I've just given as a courtesy, they're just got a notepad pen. Some have playing cards in there if you like to play cards. Some have glass cleaners, a bit of a brochure about Anglicare and coming through to Anglicare. So I've got another brochure that I've left copies of with Chris, which goes about support at home. So lots of significant things happening in the home care space. You've probably, if you're quite aware of it, extreme sort of restructuring of home care aligned with the Aged Care Act, and obviously impacting funded type programs. So in my role, obviously with Anglicare, we look at all new intake and new onboarding of new clients, so growth. So we will be covering that, and my team look after all those inquiries. So if you've called Anglicare about home care, it probably has come through to my team. Okay, I'll get started. There's lots here. So don't, if you want to sort of ask a question amongst there or questions afterwards, whichever goes. I'll try and skim if there's some things I think are probably too. I've tried to give a very broad picture, but if I really wanted to talk about support at home, I could probably talk about it all day and all night, because we're sort of getting that information through. This was postponed, so this reform was meant to happen on the 1st of July, and it got postponed to the 1st of November. So it's sort of been a grace for us because we've had more time to prepare, and people have had more time to prepare. So we'll get started. I do go through a little bit about the start of the journey, and I think before I start, I've spoken to a few people, but where are we at the journey? Who has got some home care? Nobody. Okay, some of this stuff might go over their head. But I do start at where do you start? You're probably like my mum and dad, they're 79, very resistant to home care. No, I do it myself. So I can't twist my mum's arm, and I've been in the industry for a while. Don't talk about it. Don't want to know about getting old. No. You need to know where to start. So these slides will go through the start of the journey. Look, we'll definitely go into the more nitty gritty, but I suppose we need to look at the depth that you need to go into because you're all at the start, so to speak. But we'll have these slides and some questions along the way. Okay, let's get started. So home care, and I think if you sort of think of the word home care, it's pretty understanding of what it is. Obviously, it's designed to keep you independent and to keep living in your home. It's obviously a range of products and services to support you that are tailored for your needs. Home care can be delivered inside your home. It could be taking you out, going to groups. It could be a number of things. Generally, for subsidised type services, you need to be 65 years or over, 50 years or older if Aboriginal or Torres Strait Islander person, or there is a little bit of a gap. I find there's a bit of a gap between 60 and 65. Don't quite meet the eligibility. Obviously, anything before 65 generally is NDIS, the National Disability Insurance Scheme, but I'm not all over that. So my game is home care and aged care. But the first step you need to do, and if you haven't already, is registering for My Aged Care. We use a lot of acronyms, so I'll try and make sure I don't shortcut things, but in aged care, we're a little about doctors, you know, that sort of hospital sort of jargon. We do use a little bit of acronyms. So My Aged Care, you might hear it referenced as MAC. No, it's not Big Mac, McDonald's or anything like that. It's just the starting point. So My Aged Care is the government organisation that helps deliver these funded aged care services. My Aged Care provides information on types of services. It assists you with getting an assessment. I was talking to someone just before about assessments. It's not an assessment or a test for you to fail or to not meet. It's a needs assessment. So, being honest in that assessment is really important. And obviously that will give you eligibility of what sort of funded services you're able to access. It'll assist you with referrals and support you help find services and providers that provide that service. And it'll obviously give you an idea of going to, what you need to pay towards those services. So I don't know if anyone's savvy on the internet. If you're savvy on the internet, My Aged Care have a very comprehensive internet platform, and you can put anything in there and it'll tell you. So doing assessments, income assessments of what you might need to pay. They can be contacted on 1800 200 422. It is an Australian hotline, so it is based in Queensland. So you will get someone in Australia answering it. You can go online. You can go to Selected Services Australia offices. You'll need to make an appointment with a face-to-face for an aged care specialist. But there's a few ways. So generally, starting point is calling. If you're not confident calling, call and make an appointment to go and see someone at Services Australia and start that initial registration. Okay, preparing for assessment. And as I said before, what do you need to have when you do get assessed? And as I said, it's not a test. You're not going to fail. They're not going to put you into care. It's an assessment of your needs and what support you're needing to have. So having, your Medicare card. My Aged Care is linked with Medicare and all the government programs. So they all use the same database and programs. They just don't talk to each other, unfortunately. Be government, I don't know. So you'll, if you're having an assessment, you'll need to just have your Medicare card handy, and when they register you originally, they'll take all your information and they'll ask you a little bit about you. And that's where I think you need to be honest. Because we've got very proud, a lot of people here that nobody needs home care, but possibly you do. So ensure that the information that you have is ready, so that you know what you want. From an assessor point of view, I've been an assessor. I'm a very kind assessor to people, and I always say, "Are you sure?" But normally assessors will not go, "Are you sure you don't want this?" They will actually assess you based on a tool that they use to ascertain the information that you provide. So if you say, "No, I'm fine, my daughter does that," next. So, and there's hundreds of thousands of people waiting to get assessments. So you need to consider all your needs and think of it on your worst day. So you might be having a really good day when you talk to someone or an assessor. I had a good sleep, I feel really good. But think of your days when you're not. You've got chronic pain, you've got other things happening. Think of those and tell them about those days, not your good day today that you feel really rested and you're fine. The home assessments that they do are completed in your home and they give you approvals. Obviously, some people might want to engage in private services, because I know a lot of you probably are self-funded. We're getting a lot more people now that are not full pensioners across all areas. So there's a lot of part pension, getting into the baby boomers, and we're getting a lot more people that are more financially stable. So a lot more self-funded retirees. I was talking to someone about paying contributions. Obviously, it is a contribution-based service for funded services, so it's like tax, unfortunately. It's based on your income and assets of what you pay for certain services. But having accurate information is the key. Nothing happens quickly. So just be reminded that you might be well today, but tomorrow you might wake up and twist in bed wrong and do your back or something like that. And it won't happen quickly to get these services. So you've really just got to be aware that, just be mindful that if you need them in a hurry, it might not happen in a hurry. So it's good to have them as a standby. I think most people, if you get a basic assessment done, would be eligible for some limited support, be it to cleaning. Cleaning's probably the first thing that people need a bit of help with. Can no longer do the vacuuming, mop the floor, bend, sometimes transport, things like that where they can't drive or they're on restricted licences, they need to get to medical appointments, and so those sort of things, accompanied support, shopping. So, but generally house cleaning. I think if we had $1 for every person that rang Anglicare and said, I need domestic assistance, we would be more than a not-for-profit, we would be making lots of profit to do that. So, and lawn mowing, gardening and things like that. Anglicare is not funded for all of those funded services under the entry level. I'm going to go into a bit of depth of the two types of funding and what's changing. So I know you had a meeting or you did have a presentation about the Aged Care Act, and a lot of these changes are evolving from the changes in the Aged Care Act and the strengthened standards. Okay. I'll try not to waffle because I will talk a lot. So put your hand up if you have a question. So the first program that I'm going to discuss, and it's probably where you'll probably start, is the Commonwealth Home Support Program, fondly referred to as CHSP. So if you hear us like bankies, I was an ex-bankier, but if you hear us aged care people, CHSP, it just flows off the tongue. It's Commonwealth Home Support Program. Now this program is your basic entry subsidised funded services. So it's not means tested, income tested. So people that are self-funded retirees, part pensioners can access this, but it is just basic. So it's meant to be a starting point before you get into more complex care. It is a contribution-based service, so the government actually bulk funds providers. And if you've tried to call to get some cleaning and things like that, you might think providers have said, oh, we're full gardening. No, it's because we're bulk funded. So we only have that access to those services for so long to give out so much until we sort of free up with people coming and going off the system. It is a contribution base, so you'll pay a small portion. For instance, domestic assistance, you pay $16.50 an hour and the government subsidises the rest. So you pay that small contribution towards your care and the government makes up the rest to the provider. Referrals are sent through My Aged Care, so when you have that assessment done, they'll assess of what needs you need. And it might be some lawn mowing, it might be, transport and things like that. You'll have multiple referral codes for different things. And under this program, you could have multiple people providing these services because as I said, not all providers are funded for each type of service. So you might have cleaning with Anglicare, you might have showering with Baptist Care, you might have transport with Hammond Care. So it's not an all-in-one package. It is an individual based on the need and very directed by the service that you've been approved for. So if they come there to do cleaning, that's what they come to do. Can't shower you, they've got to do what's been instructed. So there's different types of services. Capacity, as I said, can vary, but they're just some of the things that you might need. And that program is not, so if I go back, this program is not changing. So in the new reform that's, as I said, been delayed from July to November, this program is not planning to be morphed into supported home no earlier than July 27. So, and that could be postponed too. So at the moment, this program will remain, but the plan is for it to be one big program under supported home. But we've got some time for that. Supported home took 6 years in the making. It got delayed to 2 elections. And as I said, it got delayed again the last few months from July because they weren't ready. They said we weren't ready, but they weren't ready. Home care packages, HCP, sorry, another acronym. This program is changing. So this program, none of you are on that program, but this program is basically more looking at more holistically all your care needs rolled into a bundle of funding that a provider needs to coordinate with you to provide the care. So it's not just as one service here and there, it's a bundle of funding, a budget that you're given, and then you coordinate with your provider, as in aged care provider, to what you need and how you spend the budget. Now this one, as I said, the other one is not income assessed, But this one has always been income assessed. So you need to do an income assessment. And there is definitely a balk at people taking this package, this program up, because if you've got to pay the full income assessment amount daily, then it's quite costly sometimes, and there's really no benefit out of what you get for that. So it will depend. There's 4 levels of home care package currently. So one being your very basic. It's worth about $10,000, $11,000 a year, which sounds like a lot. It's not. And then 4, up to about $63,000 a year. Government doesn't give you it all in one lump. They sort of, it accumulates. And at the moment, this one, you can accumulate funds. Moving to supported home, you won't be able to accumulate funds. So this one you can accumulate. If we think of the accumulation from a point of view nationally, or more even from an Anglican perspective, we've got $24 million of unspent money in this program that people are sitting on, not used. Can you imagine how many packages could go out for that? So the idea of it is, in the new world, is that you won't accumulate, you'll use it. You have a quarterly. This one at the moment, you have a monthly budget and it covers all your costs. There's a care contribution, a coordination fee of a care and package management fee that all providers are allowed to charge. We are capped at what we can as the maximum and minimum, but it's a monthly amount that comes out. It's taken out before any of your services start. And each provider will charge their own, and we are sort of governed on what we can. So we are sort of controlled on what we can't charge. But at the moment, those fees are in there. A basic daily fee, you might be asked to provide a basic daily fee to top it up. Not a lot of providers are saying at the moment now 90% don't charge that. Anglican have never charged a basic daily fee. Income tested fee, can't avoid it. It's a daily amount at the moment that goes towards your care. It's just gone up the 20th. It's about $38.75 a day, which is really a lot. So if you're on a small package where you're only like a 1 or 2, it's probably not worth you. A lot of people just don't take it up because they're going to be paying more than what the government is actually going to give them in the difference. So there's definitely been a bit of a hesitation, and there's a lot of work that still needs to be done on the other program, the Commonwealth Home Support Program, because it hasn't really worked. It's been overutilised and really exhausted and not used as a basic entry type service. So there's a lot of work to happen with the Commonwealth Home Support Program. As I said, services under this program are very flexible. So currently you have a budget that's allocated monthly amount, and you sit down with it. You have a case manager, or we call them a care advisor, that sits down and really handles your budget. So you get the money virtually. You don't get it in your hand. It's government money for you on behalf of you, but a provider needs to run that package. Costs of care and package. People always go, oh my God, 31% combined. That's so much, but the cost of delivering care and providing care is substantial, and the cost is not going down anytime soon with the cost of living. So cost of training staff and providing care, clinical support, it all adds up. And we don't get paid huge amounts, but care workers have just been given a pay rise. If you've seen in the news over the last few years, they have been given a pay rise, so they are getting paid more appropriately, and it is much easier now for us to get care workers. COVID was very tricky trying to get care workers in. We couldn't encourage people, and obviously working in this industry, you really need to have empathy, compassion, ability to work with older people, love it. It's not for everybody. So it is a hard task to get good people, but we do have some really good people that come into this. Equipment and home modifications at the moment, as I said, you accumulate the funds under a home care package. That's going to change in supported home. So at the moment you don't get the money. So if you need a walker, you need to save up towards it. So you get a daily amount that's accumulated and you'll need to save up for it. And sometimes that's very delayed. So that doesn't work very well, that process. You need to get a rail, or you need to get a hospital bed. Very expensive. So it takes a long time to actually accumulate funds. So moving into the bigger picture, it will look a little bit different to that. So none of you are sort of affected by that, but people under this sort of program currently, a lot of them will be grandfathered. So a lot of people on this program now that are full pensioners have never paid a contribution. And if they were on this program before the 12th, and I've got more slides on that, they will never pay. So they will be grandfathered for the rest of their life. Lucky people. Okay, the other thing I like to promote, obviously within here, and I know a lot of social people, is Anglicare do have social support groups and cottage respite. Probably our closest one here would be French's Forest. So we call them a social and wellness centre, and we do have overnight cottage respite as well. So Anglicare has about 11 of those social wellness centres, is to help people connect with others, to help reduce loneliness. We know that COVID really had a big impact on people being isolated. A lot of people are connecting back up, but a lot of people were very resistant. It definitely was detrimental to people's cognition and not interacting with other people. So it's a really great environment, friendly, homely environment. Go and have morning tea, they have lots of activities, music, they go outings, they do a lot of bunning trips and different things, but it is a day group. It does help people that are living with dementia or people that are just isolated, and it also provides respite for people that are caring for someone or a loved one that's perhaps they need a bit of a break. So they run normally from 8:30 to 5, about 8:30 to 4:30 a day. So it's a good day respite. So if someone's living with dementia, looking after someone living with dementia, and they just need a break, then it's a great way to know that they're socially connected with like-minded people, and they have a ball. So the other thing is the cottage respite, and these are funded through the Commonwealth Home Support Program, and you can also access them through the home care package. But under the Commonwealth Home Support Program, it's $25 a day that you pay. So it's pretty good value for a full day. Nice meals, good engagement, lovely lifestyle workers that run them. Our overnight cottage respite, probably a little bit more further away from here. We've got two operating, one at Rooty Hill, at our village at Rooty Hill, and the other one is up at Pymble. So probably that'd be like a little B&B for you guys, up at Springwood there. So, and it's just sort of like short-term overnight sort of respite. So Rooty Hill we do 2 days, and Pymble we do 4. So we do sort of like Wednesday to Sunday at Pymble. So it's a little bit of a overnight break for people, just maybe they need to go to a wedding and they can't take their loved one with them. It's low level care, so it's not like high care where they're hoisting or doing any sort of major, it's really for low level care. But good to know if you need it. Okay, the other program that is changing along with the home care packages, and we are funded in this area for Northern Sydney, is the short-term restorative care program, STRC, another acronym. This program is currently an 8-week program. It runs for about 56 days. You're eligible for this before you start a home care package, so you can't be on a home care package and have this. A really great reablement program. It allows people that are at risk of losing their independence to have some short-term, really intensive support. Allied health, really very allied health driven, physio, OT, occupational therapy, nursing, those sort of things to sort of help with that functional decline and get people to a better level, improvement. It's not like a program that you'd have after you hospital. So if you've been in hospital, you may have come across different programs, a transitional aged care program where the hospitals arrange that. This is a different program, different funding. But this program will be changing in the supported home world to a restorative pathway. So currently it's very lucrative. It's worth about $14,000 for 8 weeks. So a lot of money that we can do with lots of equipment. Moving into the new world, it'll run up to 16 weeks, but half the money. So interesting to see how that works. But we're planning at the moment, we can only have 21 people on this program at one time. So in this region, 13 under North Sydney, and then we sort of, one goes off, we put it on. So we've got a constant wait list of them coming on and off. But it is a really good program to get you started. But yeah, I just thought I'd always like to add that in so that people are aware of that too. Okay, nitty-gritty stuff. So getting into the heart of it all, and what's happened and changed. So the Aged Care Act 2024, been a long time coming in the making. So the government has passed this new Aged Care Act, and it will take effect on the 1st of November. It was meant to take effect on the 1st of July, but it was postponed. And these changes and the Act commencing will impact the aged care system, strengthen quality standards and other programs. The home care package, as I said, and the short-term restorative care program will be replaced by the supported home program. And it takes effect, as I've said, probably a bit of a duplication there, 1st of November. Commonwealth Home Support Program, as I said, will not become part of this program not earlier, or not anticipated any earlier than July 27. Highly likely that probably will be maybe delayed, who knows. But that's the plan, okay? A little bit about the Act. I know you have had some conversations about that. I thought this was a really good diagram that the department has actually released about the new Aged Care Act, and it puts you at the centre of your aged care and gives you choice. And I thought this little diagram was quite good. So the rules and regulations, it's really going to be toughening. Really, it's a reform on providers and what we do and how we do it and how we provide care. And your rights matter. So obviously high quality care, stronger standards, better monitoring of care quality, culturally sensitive and trauma informed type care. Greater choice and transparency, greater responsibilities on how providers operate and spend money, respect for your private information, so confidentiality and privacy related things, making it more fair and sustainable funding. Single assessment, so there's multiple assessments. The single assessment process has been refined in the last year anyway, because we find that there's so many assessments. You have one assessment, then you have to have another. Then you're constantly getting reassessed. But yeah, they're sort of looking at refining the model so that there's less of that delay. And at the moment, it can take 6 months to even get an assessment for any services. So that's what I'm saying. You need to start with process. So, and the idea of this is the new program and the new act is to actually reduce that time, because we know 6 weeks, 6 days, 6 months, way too long for someone to get assessed and then wait to get assessed. So under the home care package, you might be approved for that package, but you have to wait on a wait list to get it. And people are waiting up to 12 months to get a package. Way too long. So the government has apparently released 20,000 packages a couple of weeks ago, they said. I'm not sure where they are yet, but they haven't come through yet. Well, we haven't seen them, but we're definitely monitoring. We've got lots of people that are less than a month waiting for home care packages. Some of them have been waiting for that for 3 or 4, 5 months. But we're hoping those ones will come through quickly, because they have said they're going to release 20. And I'm sure they'll either that or they'll release them all in November when we're really, really busy, and they're going to really add to that. So yeah, access, more choice on who provides your care. Entry access for some people aged 50 to 64. So there's a little bit of a window there where I think that 60 to 64 period, it's hard to sort of you're not eligible, what can you access? A strong workforce, obviously lots more regulations on providers in clear responsibilities of aged care workers. So lots of training going into place to have us ready and be all across the Act. Otherwise we'll get fined. We have to do it right. We have to train our staff right. Better screening for aged care workers. All aged care workers get screened. We have police checks. We do lots of screening. So, but even more so, I know you've probably heard lots of horror stories on the TV and current affair and all those things. There is lots of screening that goes into place. Whistleblowing protections. So obviously people who want to speak up have that ability to speak up. But your rights matter. So respecting your choices. As I was saying, my mum and dad's 79, resistant to home care. That's my choice. That's their choice. But my choice would be to get them some help. But they're totally resistant and against it. And I can't force them. That's their choice. They have the right to make that. So respecting your choices, allowing for more independence, a better complaints process, choice of who helps you make these decisions. So having a supporter. If you've got good family or supports, under My Aged Care now you have a representative, but at the end of the day you make the decision. And they're moving to calling that representative a supporter, but it's just supporting you make a decision, unless you can't make that decision and don't have capacity, but you have the choice. Respecting your culture and identity and staying connected with your community, and that's the key. So all of this is to keep you at home for as long as you can. Obviously ageing in place is we're really trying to focus on, even within our villages as well. Like, people move, you want to move once and you don't want to have to move again. So if you can prolong that, then that's a good thing. Okay, registering support. So when you register for My Aged Care, yes, you can, under the Act, you can actually, everyone's presumed that they can make their own decisions, unless it's proven that you don't have capacity to make decisions and you have appointed power of attorneys and guardians and things like that. However, you can choose to register one or many people that are trusted to support you and respect you in making those decisions about your care. Supporters are registered through My Aged Care, and their involvement must be consented to by an older person, and you have the right at any time to say, no, I don't want that person supporting me anymore, or I want to add this person. So as of the 31st of October, if you are registered in My Aged Care as an authorised representative, then you will move over to a supporter unless that relationship is decided that you don't want that person to be a part of that anymore. But it's quite difficult if someone calls My Aged Care under the privacy and things, and even when you call a provider, we can't just give that information out about persons, so you really need to be linked, like you would for Centrelink and things like that. Unfortunately, linking with My Aged Care doesn't mean, if you're linked with Centrelink, they don't sort of see that as the same relationship, so you have to have that supporter relationship or registered representative relationship to have contacts. So when you call My Aged Care, oh look, I'm a representative for mum or whatever. So so that's about supports. Am I going okay? I'm not going too fast. I'm speaking okay, not too quickly. So Support at Home, the Australian Government is improving in-home aged care to help older people live independently at home for longer. The new program that they're developing, obviously called Support at Home, is to bring together some of the in-home current programs, the home care packages and the short-term restorative care programs from that key date, I keep saying, 1st of November. So under the new home support Support at Home program, there'll be improved access to services, products, equipment, modifications to help older people remain healthy, active and socially connected. The idea obviously in this program is to free up another 100,000 places, and as I said, you think of that amount of, and there's billions Australia-wide of unspent money, think of all those places that could go towards. Currently, if people have accumulated money under that home care package program, they won't lose it. It will move over with them, but they'll need to spend it before they get any access to any more. So it will dwindle down. So eventually. And the idea of that is to, if we can create extra spaces and delay and the wait times to be reduced, the key is like 3 months by July 27, then that would be amazing. Because we're seeing it taking way too long. Get an assessment, 6 months, it's like a 2-year process, like it's 18 months to get, a package, and it's way too long. Commonwealth Home Support Program a lot quicker. You get the referral codes given to you. An assessor can send them, but, a package which is really more bulky and more worthwhile does take a bit longer to get through. Features of Support at Home. So the home care package program is a monthly budget. This program will go to a quarterly basis, and I'm not up on NDIS, but people are saying it's sounding very NDIS a little bit in how it's structured. So there'll be quarterly budget. We'll still do monthly statements. We do it on a home care package. We'll show you what you've got, you've used, what's left over. You'll still have that under Support at Home. They're doing away with some of the funding, and that's where people go, oh my God, it's so expensive, the unit prices and things. So the care management fee will be reduced. Currently could be anywhere between 15, what did I say, about 31 combined. So it could be, 10% is going to be, everybody's going to have that taken from their package and actually pooled for a provider. So the provider doesn't get it. We have to work for it. So we have to show what case management and what we have done to provide, and we claim that from the department. So that's why it's really key to have a care partner that will support you and coordinate your care and look after the program. They're doing away with the package management fee, so which really covered, providers' administrative costs of providing statements, training staff, PPE, protective clothing, all of those things and above. Doing away with that. And the government's saying, I haven't said on here, but the government said, set your own pricing. So the first year, off you go providers, set your own pricing, and then next year, from July 2026, we will regulate it. They've given us an idea of what they see as a low and high, but they really don't know what the pricing. So the unit price is going to really much be absorbed. So you'll see currently on a home care package, $85 an hour is like what we might charge for service. It could be up to $120 because the care has not changed. The cost of providing care hasn't, but the government has restructured how we charge that administrative cost. So, so when you're comparing providers, a lot of people will compare by, package and care fees and hourly rates. That's all well and good. And if you actually looked at Pymble and looked at how many providers provide home care in this area, you'd probably get 150 more of providers. But think of when you're finding a provider, finding the right one for you. So obviously I'm going to promote Anglican because that's my job and I love Anglican. But it might not be the right choice for you. So some people will go for a cheaper provider, like it's like shopping at Aldi, going to Coles, going to David Jones, so it's really going to be personal choice. I mean, someone want to get more out of the package, they want to pay lower fees, but in saying that, it might be detrimental that you might not get the quality of service that you might want. So think of when you sort of, it's like insurance. So when you're actually, doing insurance, I've always been with NRMA, went off them for a little while because they got too expensive, back with them, trusted. So think of what the provider can offer you. Providers like Anglican have our own staff. We do use agency, like we train our own staff. We have our own clinical team. What can providers provide? If their costs are quite cheap, sometimes too cheap. It's like, oh, why is it so cheap? But doesn't mean it's going to be a personal choice. That's why we always encourage people to do comparisons. And we're definitely not the most expensive, but we're not the cheapest. So just do comparisons and find the right person for you. So contributions. So what you pay on this, so at the moment on the home care package, you pay a daily amount. Even if you don't get a service, you get a daily income tested fee amount that you pay towards your care. Moving into this, it will be based on what type of services you get. So some people where the package wasn't quite viable, this might actually be viable depending on what type of service you're getting. So if your needs are more clinical, podiatry, physio, you won't have a contribution. So you might actually find where you've foregone, if you have had a package, come up and said, no good, self-funded, not going to work. It might actually be more viable now because you're actually going to be paying based on the contribution of what type of service you have. So food for thought. Moving into equipment and modifications, there'll be a separate funding. So when you're assessed for a supported home program, there'll be a separate lot of funding for assisted technology and home modifications. So you won't have to accumulate that money. Add to the confusion, I think I missed the really top thing here was there's 8 levels. So 4 for a home care package, 8, and they're calling classifications, which they are levels though. So there'll be 8 levels. People that are on a home care package will morph into those levels, so there'll actually be like 12 levels, and different people at different areas. So it's very confusing, isn't it? So I'm sure there's going to be lots of conversations at people going, "Oh, I don't pay, I do," and it's really going to be personally on your circumstances. So it's going to be definitely person to person of who pays, who was in the system previously, and things like that. So. It's not going to make it any easier, but the idea is obviously to make it more sustainable, the system. And we're living longer. People are living longer. We want to choose to live at home. So I'm all for getting this in place so we can prevent any more assisted type care. Restorative pathways, as I said, the programs are changing from that short-term restorative care program to restorative pathway to help, and it's still going to be the same principles, but it's just going to be spread over a longer time, so up to 16 weeks. As I said, a little bit less funding. We might have to be able to top up a bit of funding on that, but it's very multidisciplinary, allied health reablement type program to get people at a better level. The assisted technology and home modifications, there'll be 3 tiers of that. So when you're assessed for a classification for supported home, they'll go, oh look, you need a live life alarm, you need a personal alarm, you need a wheelchair. We'll assess you for that, and you have about 12 months to use that particular funding. The other pathway that they've created is an end-of-life pathway, and that's to provide people with dedicated funding and support to obviously gracefully live at home and die at home. And it's obviously based on the person's last 3 months of life. Obviously, if they outweigh the 3 months, then they will be able to access more funding. But it's really to support those palliative sort of care and family support, so people have choice to die at home. Not Not a nice thing we like to talk about, but that's good if that's going to help. Supported home. Have I lost anyone yet? There's lots of information. You're probably all going, what time is she going to finish? There's 3 lists that supported home. So when you're assessed, and that's why I said the key thing is saying the right things, as in answering things correctly, not, oh, I'm fine, but you're really not. So what are you needing? So clinical support. So when you get an assessment done, they'll look at what you're needing care with. So is it nursing care, allied therapy such as physio, occupational therapy, podiatry, continence care, are those sort of clinical type supports. Independent type supports will be those things like assisting you with self-administering medications and getting dressed and showering and transport and respite. And then that everyday living type services are those things that you're probably at the start of your journey, like the cleaning, home maintenance and repairs, and meals preparation and delivery. I probably think that a lot of people go, oh, I've seen Light and Easy. Everyone sees Light and Easy on the TV. Under the home care packages in this program, you will be able to access that, but there's parts of that you can't. It's not fully covered. So the cost of the providing the preparation of the meal and the actual raw ingredient is not covered. Under the Commonwealth Home Support Program, Light and Easy, you can't get. So if you see that advertised on TV, because I know they advertise quite a lot, you can't get that under the entry-level program, Commonwealth Home Support Program. You're looking more at like your Meals on Wheels and Tender Loving Cuisine, some little providers that do that under that, but not Light and Easy. So it's a bit deceptive. It's a home care package for Light and Easy. Because people go, oh, I want Light and Easy, but I've only got CHSP. No, you can't have it. Supported home and contributions, as I said, it's essential to make it sustainable. And I was talking to someone just before, like, to make it fairer. I understand, look, I think it's harsh, like if we've all paid our taxes and we've done things, but it's obviously to make it sustainable. Who can afford to contribute and who can't? And that's based on that income assessment. So contributions to services, you'll only pay the contribution based on the services you need. So someone like a self-funded retiree before on a level 2 paid that now it's $38.70 a day. If they only need a physio and podiatry, they're not going to pay contribution. They're just going to use their funding. So there may be benefits in actually taking up, whereas before it's been not negotiable, self-funded, no value. It may be something to relook at from November, that it might be worth your while. And obviously there's going to be, assessments. There'll definitely be, I think there's something, one of the team said to me, there's something on ABC tonight about supported home. So I don't know if anyone watches that, about contributions. There's obviously a bit of an uproar of what will be paid, and I'm sure it's going to impact a lot of pensioners, the amount that they're expected to contribute, and is it going to be revised? Possibly, I'm not sure. The supported home fee estimator, there is a really good link on the My Aged Care website where you can go in and put in your income amounts and your assets, an income and asset assessment for supported home. At the moment it's an income assessment, and then you sort of give it an indication, and it'll give you an idea of what type of contribution you'll need to pay based on your income, based on those service types. So that's a really good little link. This is a bit of a guide of what the standard contribution rates will be for the types of services. That's why I said it's quite critical of what type of services you're needing. Anyone from a full pension to a self-funded retiree that don't get a Commonwealth card, there'll be no contribution towards clinical. That's why I said it might be a benefit for people that are self-funded. I know I've got a lot of self-funded retirees here that, they need a bit of physio, things like that. So there'll be no contribution towards that. You just need to use what the funding is provided. So if you've got that quarterly budget, and that's where a provider will sit down. Yep.
Could you go more slowly, please?
Oh, sorry. Okay. Sorry, I'm waffling a little bit. So, yeah. So clinical support. So there'll be no contribution for full pensioners or full self-funded retirees. Independent type services, so they were the things like your showering, your medications. If you're a full pensioner, then there probably would be an expectation of paying about 5% towards the cost of that care, where you're a self-funded retiree, you might be paying half of it. But it will be based on your income and your assessment as to what you need to pay. Everyday living type services, that's like your domestic assistance, your meal preparation and your prepared meals. They will be, for a pensioner, 7.5%. For a self-funded retiree, a lot more, 80% of the cost. So some of those things, I think some of the light and easies might not be so beneficial in this world of things to have under there. It might be just as the same to actually buy them yourself, which some of you are probably already do. Okay. So classifications and budgets. So the supported home classification level is determined during your aged care assessment, and included that they'll include a classification, an ongoing service list of what they feel that you need. I would say from an assessment point of view, most assessors will assess you for most type of services. They're not going to say, oh, look, you just need physio. I'm thinking if you give them the right information, that's why I said giving them the right information is key, that, hey, look, I need a bit of help with transport, they'll give you the appropriate level. So you get a quarterly budget, so a 3-monthly budget that's based on your needs. And anything that you don't spend in that budget each quarter, you can only carry over $1,000 or 10% a quarter. So gone are the days of whatever you don't use accumulates. Moving into supported home, the maximum you can accumulate is $1,000 or 10%. So people who have already got accumulation, as I said, from the old program, will not be disadvantaged, but they'll need to use that. So if they want to get reassessed for more funding, they'll go, hey, you've got $10,000, you need to use that first for purchasing things or getting extra services. Assistive technology and home modifications, ATHM, sorry, another acronym. It's not budget quarterly. It's a like you get a year to utilise that. So, but there's 3 levels. I'm not sure of the funding levels if they're going to be revised at the moment. I feel they're not. There's not a lot in them. 500, 2,000, 15,000 will be capped. But remember, when you're looking at modifications, the government is not expecting to refit your whole bathroom. If they're going to be doing some modifications, it's going to be the basics. And it's not going to be your marble tiles, it's going to be your basic modifications, pull the shower out, pull the hob out and have it safe. So just be mindful of that. If you want a nice reno, government's not going to pay that. And same with gardening and things. There is a lot of exclusions in what the government expects is responsibility of the homeowner. So large trees, and I know we're in a really lovely suburb of trees. Trees are quite expensive. So the government won't cut trees down and won't cut limbs of trees. They see that as the responsibility of the homeowner to make it safe. But there will be some exceptions to the rules if it's deemed that there's a little bit of intervention to make it safe access. You know, cutting a bush that's sort of overhanging if it's impeding on access and things. But think of it logically from a government point of view. They're not there to make your value, increase the value of your home. It's really just to maintain it so that it's safe, okay? Okay, so the funding for each classification, there's probably a bit more indexation happening, but this was actually on the last week they updated. We're on version 4 of the manual, and I'm sure there'll be another couple of versions before this, but this is roughly what we're looking at for the quarterly budgets and the classification levels and what they're worth. So one is just under 11,000 a year. And then an 8 up to 78, just under 80,000. Currently level 4 is 63, so level 4 is probably in between that level 7 and 8. So if you're on a level 4 home care package, used to be that was the maximum you could ever get. Under supported home, you might be eligible to go to that next level and get a bit more funding. And I'm sure this will be revised. There might end up being 10, 11, 12 levels, I'm sure, moving into it, just to add confusion. Restorative pathways, there's $6,000, 12 weeks on here, but it actually is up to 16 weeks that you can access. End of life pathway 25, which is a one-off. They won't keep giving you 25 if you prolong, you'll live a bit longer. Then obviously the assisted technology, low, medium and high. And as I said, they could be classified a bit further with indexation. Yes.
Just a clarification question.
Yeah.
So just say you do your assessment and, I don't know, you come out as a 6.
Mm-hmm. Yeah.
So there's your budget of 12.
Yep. Yep.
48 per year.
Yep.
Then you mentioned those 3 levels of services. So is that money then pays for those 3
Correct.
levels of
Correct.
services?
Correct.
So, and it's going to be an individual thing, how much clinical, how much
Correct.
independence, and how much of the other category?
Yeah, clinical, everyday, and independent type services.
So then, and if you're paying a means tested amount, does that means tested amount is added to that, or that means tested amount is actually within that?
You just have to pay the difference. So the government will, you like, say you've been okay, I've got to pay 10%, like 10% perhaps. You pay that 10%, and the government makes up the difference to the provider. So you pay the difference. Yeah, yeah.
So your 10% that you pay
Is on top, like, yeah. So that it makes up the difference. So that's the maximum, but you need to pay. So they'll pay us less that.
some of that.
Correct. Correct. Yeah. Yeah. So does that make sense? Yep. Good. Look, it gets very confusing with contributions, and I think, look, there still is a little bit of a grey area in some of them. Like, how are they going to tell people what their contributions amount are? When are they going to start doing that for existing? Because you think of people in the system now who haven't been paying. And there was a magic figure, and I think it's on my next slide, but there was a magic figure of when they met in Parliament and decided and agreed to this was the 12th of September 24, and that's the magic cut-off date. So people who were assessed for a home care package after that date do not fall in that no worse off or benefited category. So anybody who was in the system before the 12th of September will be grandfathered. And if they were paying income tested fee, they'll pay the same or less. If they were never paying, so some, as I said, some full pensioners never paid any contribution, they'll never pay. But anyone after the 12th of September, and I know it's a weird date, but that's when they met in Parliament and decided on this, that anyone after that will not be. So the no worse off principle, and that's where you might, when you're having conversations with people might fall into this. Like, you might be talking to someone and say, oh, I've never paid. They're never going to pay because they're probably in that category. So if you had a home care package, you were waiting on a national wait list for one, and you were assessed to be eligible for one before that 12th, you were considered grandfather. Grandfather meaning no worse off, not disadvantaged. So that, you know, you're not going to be paying if you didn't, and you'll be paying no more than if you were. So it'll apply to you. So the principle is only related to whether or not you pay, of what you paid. And obviously the income tested fee was under the home care package. So Services Australia said you won't have to pay, you don't have to pay an income tested fee towards your home care package, then you'll never pay a contribution. And they have said, look, you know, doing these assessments, that's the other thing that we find at the moment, because we don't like to put people on a home care package until they know exactly what the government is asking them to pay, because we don't want to freak them out and actually start them up in goodwill. We actually say, look, you need to do an income assessment. Income tested fee and these contributions are not something the providers deem as to what you pay. It's what the government says that you need to pay and what we need to collect. So we're like the debt collectors of these income fees, because the government says, oh, okay, Anglican, you've collected 100 off Mrs. Jones, we'll pay you the difference. And if we don't collect that, then we're out at loss. So a lot of debt in income tested fee, because people, and that's why we're within my team, we actually make it very known, you need to do an income assessment. And unfortunately, Services Australia run about 8 weeks behind in those income assessments, which can impact obviously when you get a package, because a package, if you are aware of packages, and it will be the same under supported home, your number comes to the top of the queue. You've got 56 days to find a provider and another 28 if you want to extend it. A lot of times we're finding people have to opt back in because they've run out of time, because they haven't got all the I's haven't dotted and haven't got all things back from Services Australia. Services Australia, we had a summit earlier in the year and before the July postponement, and they said, oh, all these things are going to be assessed within 28 days. I don't know if that's going to happen, because at the moment there's quite a significant delay. So at the moment it can be taking 8 weeks to get that. You've got to do an income assessment form. It's a lovely SA 456 form if you want. I know the number off by heart. It's 24 pages long, and you've got to prove evidence of your income. So people either balk it and go, or if you've got financial advice, they may say, look, it's no point doing it, you have to pay the maximum, or you've got to submit it. So that can delay the process as well. So, but yes, we're not sure. Obviously, there's a little bit of gap in that manual that's just come out last week of how are they going to be. We assume that they're going to start telling people in October. We're getting closer to November of what they will be paying, or it'll be an estimate of like where they fall in category, pensioner, part pensioner or full. But yeah, we don't like to put anyone on until we know that what you've got to pay. So we'll always instruct you to go back to Services Australia and find out what your assessment is so that you know up front what you need to pay. Okay, we're getting near the end. Is there anything new that I can just sort of like skim over? So no one's currently in the home care package system, but anyone is that will just move over there. They're referring to a lot of people as participants. I find that really cold. We like to call our people our clients or our residents if they're in our villages. So, but people will be known as participants. They'll on a home care package, if they're currently on that, they'll receive the same amount of funding and roll over any unspent funds into there. So nobody here is really eligible for that. And I've pretty much covered most of that. So I might flip over that one to give you a bit of time. A bit of a grandfathered figure, so people who were paying income tested fee or were in that no worse off category, they'll be grandfathered, obviously not going to be disadvantaged, and they will be definitely favoured in what they'll need to pay, 25%. Less the 80%, I suppose it was for the news. So people, I think there'll be a lot of people that were perhaps declined the package a few years ago. We'll go, I might take these back up now. If you don't take up a package, it's always there. So you don't go down to the bottom of the list. So if you do get an approval for a package and you get assigned one and you decline it, it's still there. So you can opt back in and you'll get it back. So same with referral codes. So for Commonwealth Home Support Program, if you've given a referral code and you don't use it, it doesn't expire. It's there. When you get an assessment from a assessor point of view, they can actually give you codes a couple of ways. They can give you the code up front and go, here you go, find your provider for this, this and this. Or they can actually send it through a method, it's like broadcasting it. We have like a portal. All providers have a portal, like a communication with My Aged Care. The only problem is if a provider is closed, and I will say that we're probably closed for cleaning, but with exceptions that we definitely look at case to case. If we kept it open, we'd get hundreds and thousands of referrals that we just can't get to. So we try and sort of open and shut it a little bit. So if you're with an assessor and they give you a code and you really want to go to Anglican or want to go to a certain provider, I would encourage you just to get the code given and not get them broadcast, because otherwise they'll just broadcast it to whoever's open and you'll just get... It's a little bit of a system where it's first bite of the cherry. So a provider will get a referral and they'll go to a whole lot of providers, and the first one that picks it gets the first go at it. And then they'll call you, and then they all start calling you. So if you're wanting to actually go to a particular provider, but be mindful under that CHSP program, and you're not going to get the same provider possibly to do all the services, but you can go to them directly and find that care. Okay, we're there. So My Aged Care. So we're at the end of it. So where to go, what to do. I think everyone in this room is pretty much at the starting point. So My Aged Care can be contacted 1800 200 422, open Monday to Friday, 8 a.m. to 8 p.m. Fine, if you can't get through in the peak of the day, it's much better. It's honestly much quicker to get through than Centrelink, any of those other sort of hotlines, government hotlines. I always encourage people, if you have trouble getting through, do it later in the evening. Because you get through quite quickly. As I said, it goes through to Queensland. It's a Queensland-based centre. They're also open on Saturdays, 10 a.m. to 2 p.m. You can go on the website. I'll have this in the slides. You can go on there, have a little play. If you're savvy on the website, there's lots of, put in keywords, support at home. You'll get all the information. If you're wanting more information through Anglican, through my team, I look after the customer engagement team, and our number, you can call us on the little brochure that I've got there. There's a 1300 number, which will goes through to Anglicare's main line, or you can call our team directly. We have our own queue. The 1300, if you hit 2 for home care, will come through to my team anyway. So they'll help you, they'll unpack things, they'll assess what you're needing. What we do from that point of view is we'll arrange a consult. So generally for the entry-level services, we just do a phone consult and we start coordinating the services that you need. Home care packages are more complex care, we come out and do face-to-face. And we do a non-obligation face-to-face as well. So if you're wanting to compare providers, we really do encourage you to compare. You know, it's like, you know, compare the differences. Our email is also there at home info at Anglicare for all new inquiries. And that's that. How did I go? And there's a few little links here for some information. So support at home resources. As I said, there's so much coming out. I've got the links for Anglicare. I've actually printed up some brochures about support at home and I've given them to Chris. So if you want an actual booklet, it's a really good little booklet that we've produced. But we do have, I can send an electronic version of that to Chris if she needs to share it. It explains support at home of what I've explained in a bit more depth. Oh, not so much more depth, but just, you know, so you've got it sort of more physically there. So, but look, you know, ask questions. I think the key is nothing happens quickly. So you need to, you know, get registered. I think everybody here, as much as everybody's independent, would probably have an ability to get approval for one thing. You know, I've got arthritis. We have to prime people up, we call, because, like, you know, there's a very stoic generation of people. I'm sure the generation my children down will be like, give me, give me, give me. But this generation up, they're very stoic and we don't like to ask for help, like my mum, because they see it as a sign of weakness. It's not weakness. It's to actually keep you independent at home for longer. So that's that. Any questions? Yes.
You talked about different levels of income
Yep.
to assess aged care at home.
Yep.
What is the cut-off point in anything at all?
It's sort of like 34,000 for a single, and then probably about double that for a couple. So, but it's really something I would suggest speaking to Services Australia and getting the right information. But it's individualised. So yeah, it is pretty low. Yeah, based on the aged care sort of like, you know, pension sort of level. So it is quite low. The new scheme of things with support at home, it will be assets, not your home, but other assets that are sort of, you know, able to be converted into money. But yeah, so at the moment it's more of an income, but it will move into a more income and asset assessment. Yeah. Yes.
When I last had information from Services Australia,
Yep.
they advised that if your assets are borderline,
Mhm.
you may gift all or part of them, and after 5 years, have a clean slate reassessment.
Yeah.
That was
Yeah, definitely. Because I think, yeah, there is that bit of a 5-year window where it's still classed as your asset. Yeah. Yeah, that's it. Yeah. So it is hard. I mean, it is tricky. And we're getting into a generation where people are very more stable financially. No fault of their own. You've all worked very hard, you know, but it is hard. So, but to make it, as we can see, make it sustainable because we're living longer, more people to service. Yes.
And Services Australia, for people who are asset rich, they can advise on how to best utilise your asset if
Yep.
your needs are over and above what the provisions are.
Yeah. So I think it's really key to get good financial advice. If you have got a good person and really aged care related, obviously, you know, it gets quite difficult even when you're looking at residential type care and things like that. But I think you really need to go to a specialist that really will advise you well about your income. I don't like to get too involved in that because obviously my part is about the delivery, but really the cost and all that, that's really something, as I said, we can't, you know, as much as sometimes we go, oh my God, that's terrible, you have to pay, but it's really what the government deems based on your circumstances. So, but yeah, good, yeah. So, yeah. Yes. Oh, sorry. Yes. Yes. Incline is probably very expensive. Yeah, you'd obviously have to meet the eligibility for that 15,000, and that's one-off, possibly. I wouldn't say no, but I'm not an assessor, and obviously, yeah, but you might be able to. But inclinators, yeah, like I think, is it for inside the stairs at home? Yeah, like a chair. Yeah. So possibly, but that 15 is capped. But yeah, definitely worth a try. Yeah.
Just on payment, if you have a service and you have to pay 80%, you pay 100%
You pay the... So... We'll get the difference. So, like, we have to collect from you the 80% and then we get the difference. Yeah, you pay the provider the 80%. And then the difference is given to us from the government when we claim. Yeah. So you're sort of making up, like, if the government in a virtual world, if they were paying for all of it, they'd be paid the full amount. When we go to claim, they'll go, okay, you've collected from John 80% and we'll give you the difference of 20. So we're a debt collector for the government. So we do collect, yeah. So So it's really critical that people know what they need to pay, and up front we're very honest. We try and be very transparent, because there's no point starting a package if you go, oh, I don't need to pay anything. We're not going to tell you that. We're not going to sugarcoat it and go, you need to know. So yeah.
So if you'd signed up with Anglicare for a new system,
Yeah.
so you'd pay 10%,
The pooled amount, the 10%, the care management, yeah.
so you'd be paying that.
Yeah, that comes out of your funding. So before your funding comes through each quarter, 10% is pulled to your provider. So you don't see that 10% at the start.
So if you're paying a contribution, means test contribution,
That's separate.
you're paying that,
Yeah, yeah, yeah.
So you're paying the full 10%?
Everyone will pay a flat 10%. So 10% for each package that any provider has, 10% will be pulled to them. So they'll have a little account. Service Australia will have a little account for our Anglicare or Baptist, and say we've got over 1,600 packages, 10% for each of those packages, but we don't get the money immediately. So under the current care and package, we have that there, to pay, coordinate services. We will need to actually prove, a bit like a solicitor or a lawyer that bills people. So we'll have to show what we have done to provide that care. So the 10% you won't see that. So when you have a package, 10% will come off immediately. Does that answer your question? Not really. What?
The question is, okay, so you've signed up, you've got a package,
Yeah.
and there's those three things.
Yeah, the 3 types of services. Yeah.
Different percentages that you pay based on means testing and based on whether it's a clinical and independent.
Yeah.
Or a
Yeah. Yeah.
But the 10% management bit, I understand it comes off your pool of money.
Yeah.
But what is the government putting into that, and what are the participant putting in based on their needs?
So they give you that quarterly budget. So you've got the quarterly budget, 10% comes out. And then obviously, depending on what type of services you want, with that quarterly budget, we'll sit down and go, okay, you can have 5 hours of this, 2 hours. So we do a bit of a budget of what we need to spend. And obviously, based on that, what you need to pay towards it. And then the difference we claim off the department for it. So... I don't know, maybe we can have a chat, we can have a bit more of a chat if we can, yeah.
If the provider were to go into liquidation, does the government support the contributor?
Oh, I've never seen a provider go into liquidation, but I've seen providers come together. So you might find there might be a little bit more of combining providers, but I haven't come across that. I'm not sure how that would work. I would hope that Anglicare wouldn't be in that situation. But I'm sure there is lots of profit providers out there, and obviously lots of non-profit providers. Obviously Anglicare has a lot to support ours as a not-for-profit. But I haven't come across... I'm sure there is, yeah, but I'm not sure how that's covered. Hopefully they wouldn't be disadvantaged. And that's where I suppose it comes back to reputation and finding the right provider. As I said, there's lots of providers out there that can provide the care. So, yeah. You can. So if you're not happy with a provider and you need to keep the provider honest, you can change providers. You just give them an indication that you want to change. Currently, it's 21 days notice, and providers will vary because you do enter an agreement. It's like a contract, but there's no exit fee or anything like that. If you are not happy with your provider, they're not doing the right thing, they haven't fixed things, I would give grace for providers to get it right. Because every provider is going to have probably issues with staffing and changes and things. If they're not getting it right, they're not communicating. Yes, you can change providers.
You mentioned that when you put money in, a certain amount can be rolled over.
Yeah.
$1,000 or something.
Correct.
What happens to the money that you've paid that's more than that?
Well, the contribution is based on the services you get, so that money's gone.
You've got quite a good run and you don't need, I thought,
You're only going to be paying for what services you actually get.
but you have to keep putting money in.
No, you're only no. You'll only need to pay. So if you've worked out a budget and you're only having 5 hours of service, you're only paying on those five hours of service, not paying any extra.
Because we were told originally you have to open a new bank account and the money goes in every month, whether it's spent or not.
Oh no. At the moment it accumulates, but at the moment you pay a daily amount.
That's what I mean.
Yeah.
Accumulation. What if you don't spend your accumulation?
Well, yeah, like you'll only pay what you get, so you won't be accumulating any money. You'll only be paying on what you get. So gone are the days where you'll be paying 7 days a week for income. You'll only be paying, if you're only getting 2 hours of service a week, you're only paying on those services you're getting. So there won't be any accumulation. Yeah. So a little bit different. So it is really confusing, and I think it might be something we need to revisit when we're in the scheme of things, and I'm sure it's going to be a bumpy ride into November and beyond. So it might be something if Chris wants, if we want to revisit something in the new year, or once we're into the scheme of things, because I'm sure this is going to probably spur lots of conversation and more conversations. Yeah. So you're registered with My Aged Care, no services used, yeah? Yep. 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 So the CHSP that you're with is not changing yet. So the entry level services are not changing yet. So they won't impact you unless you're needing more help.
I don't need any help at the moment.
No.
Do I have to do anything before the 1st of November?
No.
Does it happen?
No. No, there'll be nothing that you need to do. You'll still have that approval for your meals, but if you need more, what will happen from the 1st of November, what I would say, and I think they'll be more inclined to assess you for a classification level, and they might give you some CHSP codes as well. So if your needs increase, they'll give you a classification, and they might go, hey, here's a cleaning code. Oh, okay. Yeah, very hard to get. Correct. You haven't used it. Yeah. So nothing's changed, then nothing's need. Same with people waiting on it for a home care package. If their level is still appropriate, no. But be mindful that the CHSP, the idea of that is going to move into supported home no earlier than July 27. So ideally it's going to be one funded program. How that works, that's why they've got to test the waters with these other programs first before they bring it all together. Yeah.
System completely separate from nursing home assessment?
Correct. Yes, this is home care. Yeah, so this is home care. But residential care is obviously still governed by the Aged Care Act and the fees. So that's not my forte, and I'm happy to organise someone to speak to you all about residential care, but that's not my forte. But yeah, this is home care. But the Aged Care Act is definitely implemented.
So there'll be separate departments, separate staff?
Yeah. Yes.
For people with interim needs that are clinical, they can go to St Ives Community Centre where there is a social worker coordinator. There are physio, OT, other clinical services you can obtain in the meantime. So
Yeah.
if you have a fall and come home, there are services available already.
Yeah.
You don't have to be fully into the system.
No. If you go into hospital too, there's programs that they have in place to get you back home. So you might have come across compacts, like a 6-week complimentary type service that gets you back to sort of help at home, might help someone come in to help you showering. It's just 6 weeks. Yes, definitely the community type programs.
Longer.
Yep. And also too, if you have a significant fall, you might be eligible for programs that the hospitals have, like transitional programs that run in the hospital. I'd also encourage you, obviously you probably do, use the Medicare the 5 visits a year for clinical, like allied health type services. I'm sure you do, maybe for podiatry and things like that. Don't get it?
2 years ago,
Yep.
I had a ramp put in
Yes.
our back steps.
Yes.
I wasn't receiving anything else like in-home care packages.
Yep.
I didn't need them.
Yes.
And they led me to believe there were 2 lots of budgets.
All right.
That there was the maintenance one lot and there's a budget.
Right. Okay.
I had a feeling
If you got a ramp, you probably got it through the Commonwealth Home Support Program. Did you pay a contribution towards it as well? Yeah, so it would have been through the Commonwealth Home Support Program, but they're going to have that assisted technology funding level, so that's where those ramps and things could possibly be used through that. But they'll still have the codes for the home modifications. Yeah.
Judging by all, I think everybody's ready to go. Let's thank Kylie for her presentation. And for your information, we have recorded today's session and it will be available on the St Swithun's website. And also, Kylie's given me a nice thick wad of A4 paper that is a sort of a basic information booklet of today's presentation as well.
Yeah, that's Support at Home. So if you want
Support at Home, yes. I've got a limited number of copies, but I will be printing more. If you missed out on a little sample bag, Kylie's got some more, so please see her before you go. Someone was asking about residential care. Our next seminar is Thursday this time. This is just to keep you on your toes. Thursday, the 2nd of October, and it is on residential care. As with home care, the changes are myriad. And, some things will remain the same if you're in the system already, but if you're not, and, 20, 40, 60 years down the track, you might need to wander into a residential care facility for a little while, then you will need to know what it's going to cost you and what you get back, or what you don't get back, and all of the associated rules and regulations with that. So that's Thursday, the 2nd of October, same time, 10:30, morning tea. So if you still have some questions, I'm quite sure Kylie wouldn't mind answering individual questions. Just come out the front. Thank you for coming, everyone. It's lovely to see you. And now you're armed with all the information.